my name is Jessie and I'm a nurse practitioner student. Today, with your permission, I will perform a comprehensive physical assessment. This is completed for educational purposes only, so you'll hear me talk throughout the duration of the exam, but I will need your consent to move forward.
Yes, of course.
Do you consent to being recorded by video?
I do.
Okay. So we'll start first by having my hands washed and sanitized. I would like you to verify your name and date of birth.
My name is Matt, and I was born 5/3/98.
Okay, and can you tell me about your 4th of July holiday?
It was good. Spent time with family, grilled, had some barbecue. How about yourself?
Mine was good. By asking these questions, I'm observing that he is alert and oriented. He's able to tell me about a recent life event. He was able to confirm name and date of birth, so I'm aware that my patient is alert and oriented. Through speech and through appearance, I can tell by his posture. He's generally well appearing, calm demeanor, and an overall very good general appearance. I can assess mood through him saying his holiday was good. He appears with a grin today and is sitting upright comfortably. He is, to clarify, has a great mood, good affect, and at level of consciousness, I could say confidently that he is alert and oriented ×4. His speech is very clear, it's articulated well, and there's no visible abnormalities. So we obtained vital signs at the office. His blood pressure was 122/80. His temperature was 36.7 Celsius. His respiratory rate was 17. And his pulse ox was 100%. He is stable on room air. And let's see. Are you in any pain currently on a 1 to 10?
No, I'm a 1.
Okay, and we have a stable heart rate of 62. I'm now going to move forward and begin assessing your skin. Has there been anything making you uncomfortable recently? Any itching, any rashes, any areas of specific concern?
No.
We'll start with your hair. So I'm first going to be assessing the hair just for any parasites. I don't note any parasites on my exam. I'm assessing to make sure that his hair is evenly distributed. I don't note any alopecia. I don't note any dry skin or dandruff. Back of his neck is dry, it's intact, there's no red raised bumps, no birthmarks, no bruising, no redness. Move forward, look at your face here, your arms. Again, no nevi, no birthmarks, bruising, redness, petechiae. You have a nice even skin tone. Look at your legs here. On the other side, good. No bug bites from your cookout.
Nope.
Okay, I'm gonna have you stand up. I'm just gonna assess the back of your legs.
Okay.
Very good. Okay, very good. You can sit back down. I can tell that the temperature is appropriate. His legs are warm, arms are warm. To the face, there's no acne, there's no redness, no birthmarks, no scars, lesions. There's good turgor with pinch. I'm going to assess your legs here. Skin appears symmetrical. I'm now going to move forward and I'm going to palpate your sinuses and your temporal artery. So feel my touch here. I'm just going to palpate the frontal sinuses and then also maxillary. Do you feel any congestion here?
No.
Any discomfort? Any recent mucus drainage?
No.
I don't feel any inflammation. Nothing is draining. Very appropriate. While we're working on your face here, I'd like to test cranial nerve 5. So are you able to feel my touch on your face?
Yes.
Down here too?
Yes.
On the chin?
Yes.
Okay. And on your jaw, you could feel that?
Yes.
Now testing for cranial nerve 7, I'll have you smile. Can you puff your cheeks? I'm looking while he's doing this for symmetry, and I'm observing his facial movement. Go ahead and raise your eyebrows for me. Smile, frown. Very good. I'm now going to move forward on the exam to examine your eyes and your eyebrows. First, just from visualization, I can tell that there's no jaundice. I don't know any yellowing of the skin in the sclera or the whites of his eyes. They're shiny white. Eyebrows are evenly distributed. There's not one higher than the other. They're very equal. I'm going to pull down here on your under eyelid and just assess. It is light pink. There's no redness. There's no drainage. Have you experienced any eye drainage since the past time I saw you?
No.
Okay. I'm also going to note the size of his pupils here. We are in a little bit brighter of a room, so a little bit smaller, but about 3 millimeters, which does fall within normal limits. I'm next going to measure we do have symmetry on both sides for the palpebral fissures. I note that the eyes fall equal within the socket. I don't notice any strabismus currently. I will next assess for accommodation. So what I'm going to have you do is look at my pen light. Keep your head as still as you can. This is going to come a little bit closer to you and keep a good visual acuity on it. I notice that his eyes are following the pen and evenly coming across to the nose and then back out. Great job. I will next be assessing cranial nerve 3, 4, and 6. And I can do this also by using the 6 cardinal fields of gaze. So I will again ask you to keep your head still and follow my pen light, just using your eyes. Good. Okay, next this will get a little bit bright, but we will just be texting your reactivity of your pupils. So go ahead and look kind of off into the distance, kind of behind me. Very good. Wonderful. Very good. And when I do this, I notice that there's no shaking, that there's adequate symmetry. I don't notice any strabismus. I could tell that the pupils are equal, round, and they are reacting to light and accommodation. Structures are clean, dry, and intact. No redness, swelling, or drainage. And he is very responsive to the pen light. Okay, before putting the Snellen chart up on the wall to test your vision, we will use it to have you cover one eye, and I can assess confrontation of the periphery. So I'll pass this over to you and have you cover your left eye first.
Okay.
Using just that one eye by looking at my nose, I'll hold up some and wiggle my fingers in different directions. Just tell me what I'm holding up.
Okay.
So we'll start up here.
3, 2,
Okay.
3, 2,
And then cover the other eye.
2, 3,
Very good.
2, 3.
So you're able to see out of your periphery me wiggling my hands.
Yes.
Okay, cover the other eye. What am I doing with my fingers?
Wiggling them.
Same side?
Yes, wiggling
Okay.
them.
And then I just give you a minute, we'll tape this up to the wall and have you stand about 6 feet apart. I now have my patient standing for the Snellen test to test visual acuity. I'm going to sneak by you on this side so that I could be seen. This is not a standard size Snellen chart that was sent, so it will not align with Bates' recommendations of the distance for a standard size. We'll follow the instructor's order based on the smaller Snellen chart, which does state 6 feet apart to measure visual acuity. So I'll have you cover first your left eye. And then if you could begin down at line 3, and we'll get as far as you can.
Okay. FPHOLCF DHJBS EPTZO CFBHJ LTFPH.
Lovely. And then I will have you uncover that eye and cover up the other side. I'll give you a second here. Just to confirm, we are currently not wearing any glasses or contacts.
No.
Any changes in your vision recently? Any blurred vision?
No.
No. Okay. And then I will have you cover that eye. Go ahead.
Okay.
Same lines. Third down.
All right. FPHOLCF DHJBS EPTZO CFDHJ LTFPH.
Okay. And while you're covering eyes and standing, I am, since I can get a little bit closer to you in the recliner, going to work with your periphery one more time.
Okay.
So I'll have you cover one eye at a time, and then I'm going to reach just kind of arm's length above you. I want you to tell me when you can see my fingers enter your periphery.
Okay.
So cover same eye. Perfect.
I can see it.
Okay. And then I'll have you uncover that eye and cover the other side. I'm looking here first or business when an eye is uncovered.
I can see it.
Okay, very good. I now have the patient seated back in a chair to begin an ear exam. I'll first start by assessing the ear. I'm looking for, just through palpation here at the tragus, pinna, the external ear. I'm looking for any tenderness. Do you feel any tenderness here?
No.
Okay, I'll assess this side. If you could turn your head for me. Any tenderness up here?
No.
Down here?
Nope.
Okay. I don't note any drainage, but I will then first use my otoscope here. So I'm going to gently pull back and upward on your ear, and you'll feel this inserted. Okay, I'll use the other side. Thank you. And I don't know any drainage. Is there any pain in the inside of your ear at all?
No pain.
Okay. All right, we will next do the whisper test. So I'll have to kind of stand behind you. I know this is your recliner, so it's a little challenging. And I'll have you cover one of your ears. And when I'll have you cover it with a pointer finger so that you can rub your tragus if you're familiar.
Okay.
And we'll do this so it doesn't cloud your hearing on the other side. What my goal is with one side being obstructed is that I can properly test your hearing on each side. I'll say 3 either letters or numbers, and then when I finish the sequence, I'll have you repeat back to me what I said. So go ahead and cover your left ear. Ready to rub your tragus. 3, 2, 1.
3, U, 1.
Okay, and then we'll switch to the other side.
TV3.
Very good. And I'll next grab another instrument here. To wrap up testing the ears, I will now conduct the Weber and the Rhine test, testing cranial nerve 3 specifically. So this is first going to be placed on the top of your head after I strike it to initiate sound conduction. I want you to tell me if there's a change where it's louder in one ear than the other, or if you feel that it sounds the same on both ears.
Okay.
You ready?
Yes. It's even.
Okay. And then the next one will actually test each ear individually. One portion of the test will go behind your ear, and then the other one will be directly in front of it.
Okay. I hear it. Yeah, that's louder.
Okay. The other side.
I hear it. Yeah, It's
Louder?
much louder.
Okay, which is normal because the bone conduction is usually less sound. Move forward to assess your nose. I'm looking at the external appearance of the nose to assess for symmetry, any deviation, swelling. None of that is present on my exam. You'll feel my touch here. I'm just going to kind of touch the outer nose. I don't feel any inflammation here. I know we already kind of palpated your sinuses as well. I will now have you cover one nostril and go ahead and take a nice inhale. Any obstruction on that? Okay, other
No.
side. Very good. I will now use this scope to assess to see if there's any abnormalities, specifically if there's any swelling, bleeding, inflammation internally. I'll have you tilt your head back, and then you'll feel my touch here. I don't note any drainage, swelling, bleeding, or anything abnormal in the right nair, and also the left nair looks really good. No septal deviation or nothing abnormal in the nasal mucosa upon my exam. I'll now move forward to inspect the lips. Briefly, by a glance, I can first assess there's no lesions, ulcers, no cracked or dry lips. Nothing substantial. His lips are pink, they're symmetrical, and from here I'll move forward to assessing inside of the mouth, specifically to the gums, teeth, tongue, and we'll move forward there with some better lighting here. So again, I'll have you tilt your head back. Go ahead and open your mouth wide. I'm looking here to see if there's any lesions, ulcers, bleeding, inflammation, and I don't note that up on the hard palate. It appears strong. I typically would be assessing the tonsils here, but he has had his tonsils removed, so if I were to grade those, it would be a grade 0. Could you put your tongue down a little bit? Very good. No swelling to the back of the airway. Teeth are white, clean. The mucous membranes are pink, moist, and I'm going to kind of pull down your gums here. Sorry. And then I'll have you stick your tongue out and pull it to one side. Very good. And then the other side. Very good. And then go ahead and stick your tongue out for me, testing the hypoglossal nerve. Everything is symmetrical. Very good. And then if you could also open your mouth and just give me a big ah.
Ah.
Lovely. By doing that, I'm able to test for cranial nerve 10. For testing for the gag reflex, cranial nerve 9. Stick this to the back of your throat here and depress. Very good. I'm sorry. Alrighty. Upon exam, there's no lumps, ulcers, no cracking. I don't note any nodules or white patches on the tongue. It is pink, moist, and intact. Like I said about the tonsils. Okay, we're now going to be assessing the neck and lymphatic system, but I'll first like to assess the range of motion of your cervical spine. So I'll first ask you to look up at the ceiling and then return to me, and then now put your chin to your chest. Okay, return to me. I'll have you look each direction, other way, and then if you can, return to me and touch each ear to your shoulder. Very good. I'm now going to assess the neck. I'm first looking at symmetry. I don't note on inspection any masses, lumps on either side. His neck appears symmetrical. I don't note any enlarged glands. I'm next going to begin by palpating the lymph nodes. So there's 10 regions of the lymph nodes, and I'll be using the pads of my fingers to evaluate these. The periauricular are right in front of the ears. I want to notice if I find anything that's hard and fixed. All lymph nodes should be discrete and mobile. And then I'll go kind of behind the ear, the posterior auricular, which is near the mastoid process. And then I'll actually move down the cervical chain here to assess the subclavicular. Any tenderness?
No.
And then back up jawline for the submental and submandibular. Upon palpation, all lymph nodes are discrete and mobile. I would now like to assess the trachea for any deviation. So just kind of inspecting here, just visually I can tell that there's no, very symmetrical, nothing's deviated, but I also palpate. Any tenderness here?
No.
No masses. I don't hear any stridor upon his breathing, but I'll also auscultate. I'm gonna have you tip your head slightly backward. I just want to look at your thyroid. Any tenderness?
No.
I'd also like to have my patient take a sip of water. Upon swallowing, the thyroid should slightly rise with swallowing and then fall with rest. So I'll have you take a sip and then kind of lean back as you swallow.
Okay.
Very good. Moving forward with the neck region, I would like to palpate the carotid artery. We do this one side at a time for safety purposes. This carotid artery is about 2+, nothing is bounding. And I will now auscultate with the bell to look for or hear a bruit. I'll have you hold your breath while this touches you just so that your breath sounds don't interfere. Very good. I'll next move forward with the remainder of the cardiovascular examination. So I'd first like to ask if you have any history of cardiac conditions.
No.
Any chest pain?
No.
Any history of chest pain?
Nope.
Okay. Just upon visualizing, I can tell that I don't see any pulsating at the chest level of the heart. There's no lifting, no heaves, but I will move forward with a auscultation exam using first the diaphragm at the aortic valve, which is located at the second intercostal space on the right side. I'll move to the left second intercostal space to hear the pulmonic. And then down to Erb's point, which is the third. Down to the tricuspid, which is the fourth left intercostal. And then the mitral valve, which is fifth left intermedial midline. I can auscultate S1 and S2 sounds, and I'll now use the bell. I would now like to assess for jugular vein distension. It's more appropriate to assess for this on the right side of the patient because of the aorta being located on that side. So typically, given our exam situation, I would have the patient at between a 30 to 45 degree angle. So maybe I'll just have you like lean back slightly. And then if you're able to look to your left, I'm looking for jugular vein distension, any pulsating. I do not note that on exam. It's best for him to be sitting and then seated to the left to have an appropriate visual. You can go ahead and return your gaze this way. I did not note any distension or any bounding, so that's appropriate. Sometimes that appears when you have fluid overload with cardiovascular conditions. I would next like to assess capillary refill. So what I'll use is actually both of your hands, but we'll start with your right hand.
Okay.
Go ahead and lift up towards me. I will kind of push on the bed of your finger here. I'm looking for your color to disappear and then quickly return within 3 seconds. It return to pink within a second. Same on this side. I'll next like to look for any edema, which would be swelling typically in the feet area. Have you noticed any swelling
No.
recently? Any pain here?
No.
Temperature is pink. And warm. Very good. And then I would next like to assess your pulses. So we'll start radially. Okay, and this side. I can assess from the edema and from pulses that we have good perfusion, also through the capillary refill. I'll assess brachially on the side. Very good. And also on this side. Kind of relax your arm. Very good. And then I'll actually return down to your feet.
Okay.
Just for a pedal pulse. Very good. And on this side. Very good. Now for our respiratory assessment, I'm first going to visualize to see if I notice use of accessory muscles from the front of my patient. I don't notice from his neck that he is pulling to breathe. I don't notice that at the rib cage, but I will have you stand up so I can also assess from the back. So go ahead and take a deep breath in and exhale out. I'm looking here, I don't note any unilateral lag. I don't notice that he is pulling for his breathing. And I don't notice that there is asymmetrical expansion. Go ahead and take another deep breath in and exhale out. Very good. I have you sit kind of on the edge of the exam chair here just so I could still have access to the back. Most importantly, at an overall glance, I don't notice any extreme pallor. I don't notice any circumaural cyanosis. When I did his capillary refill, I was also assessing his fingernails for any clubbing, and that was not present on exam. So moving forward, I will then start to palpate for tenderness. I'm going to palpate your chest and then also your back.
Okay.
So I want you to stop me or tell me if you feel anything to be tender. Any tenderness back here?
No.
Okay. And then the back side. Any tenderness back here?
No.
Anything down here?
No.
Okay. I'm now going to place my hands about at the 10th rib softly. And when I tell you to, I'll have you take a nice inhale. I'm looking at my thumbs here to see if they expand symmetrically to test for symmetrical lung expansion. Go ahead and inhale deeply. And exhale. One more time. test for fremitus. So what I'll do is you'll again feel my hands on your back, and I'm looking for vibration in the lungs here. I'll do this by having you repeat when I ask you to say the number 101. And you'll have to say it a series of times so I can assess your lungs fully, but we'll start up top here. Okay, go ahead, 101.
101.
Again.
101.
Again.
101.
And
101.
very good. Now while I'm at your lower back, I'm going to assess for CVA tenderness. So tell me if you feel any tenderness here.
No.
Okay. And again.
No.
Okay, now for percussion, this is important to establish if the tissue in the lungs is air-filled, fluid-filled, or consolidated. It's one of the most important pieces of a respiratory examination. So you'll kind of feel me place one hand on your back. I'll leave a couple of my fingers lifted because I do not want them to interfere with the chest wall and the vibration that I'm assessing for. So my middle finger will be placed here, upright, and then you'll feel me kind of pat this hand. And moving down the back in a ladder-like uniform, just so that I can assess from side to side. Okay, very good. I'll now auscultate your lung sounds going from top to bottom with my stethoscope. But I would like you to cough once or twice so that we can alleviate any mucus in the airway.
Okay.
One more time. Thank you. Upon auscultating the lung sounds, I can tell from anterior, posterior, and lateral lung sounds that they are clear, equal, and unlabored. It's important to assess bronchiovesicular lung sounds, vesicular, and the bronchi total to get a clear picture of the patient's status. While I have you on your side, I'd like to test for cranial nerve 11. So you'll feel my hands placed on your shoulder, and I'm looking at your accessory muscles here. What I would like you to do is shrug your shoulders up against my resistance when I give you the go-ahead.
Okay.
Okay, go ahead. Very good. Accessory muscle strength is even. Testing cranial nerve 11. Okay, for the next portion of our exam, we'll now assess the abdomen. So for the purpose of utilizing the recliner as an exam table, I will go ahead and lie this backwards as flat as I can. Just gonna kick out here, and then go ahead and pull back.
Okay.
And also put this underneath your knees if it would make you more comfortable. For the purpose of this exam, he will remain closed for decency because it's going to be posted to YouTube. But ideally, in office, our patient would be in a gown where I could completely visualize the abdomen. For educational purposes, what I would be looking at his abdomen for is contour. First and foremost, is the abdomen symmetric? Is the umbilicus symmetric? Are there any bulges, masses, any enlargement? Even from his size, because he is fit, I might notice if he has any peristalsis or if his aorta is pulsing. It would probably more likely be visible on exam. Next, moving forward with an abdominal examination, we'll just say that his exam was within normal limits because I'm not going to remove his shirt. I would auscultate. The reason that we would do listening prior to any palpating or percussion is so that no movements or maneuvers with your hands would interfere with bowel sounds or any air or even gas in the abdomen. So I'll move first, auscultating the abdomen in all quadrants. I first auscultated with my diaphragm. I'm listening for any signs that could indicate hypoactive bowel sounds, any potential obstructions, any potential inflammation, but I can hear peristalsis throughout the abdomen, which tells me that he does have active bowels. I'm next going to auscultate for bruits. So this will go over the aorta using my bell. And then over the renal and iliac artery. I'm now going to percuss over the abdomen. I'm looking for any dullness or tympany just throughout the abdomen. I'll do this in a circular motion. Very good. I'm now going to palpate the abdomen. I'll first start with a light palpation about 2 centimeters deep to first assess for anything that's tender. This is a light palpation done with typically one hand, and then a deeper palpation will be done following that, about 4 centimeters in depth, and that will be using 2 hands for a maneuver. Any tenderness here?
No.
Any pain?
No.
It's important to assess the patient's behavior during this exam because even culturally or per gender, there are some people that will kind of disguise their pain. So I'm looking for any tenderness or guarding, any rigidity, anything that could be an indication that your patient is uncomfortable. So I don't note that. He's very calm. He has his arms rested at his side. But something that you might want to do in the event that you notice that is assess for rebound tenderness. And during that exam, you would apply pressure to the area that is tender. And if you withdraw the pressure to that area and there is an increase in pain, that would mean that there is a positive indication of rebound tenderness. I'll now move forward with a deeper palpation about 4 centimeters down. I'd like you to stop me if you feel any pain. I use 2 hands for this. I don't note any firmness. He's no guarding. There's nothing hard. No masses. I'll next move forward to percussing the liver. which is kind of hidden, behind the lung. And then I'll palpate the liver and I'll place my left hand behind his back for comfortability. Anything firm,
No.
hard, any tenderness or pain?
No.
I don't note any enlargement on my exam. And then I will next assess the spleen. I'll put my right hand underneath the patient and palpate. Very good. Any pain or discomfort?
No.
Any GI upset recently?
No.
Okay. Now that we've concluded our abdominal exam, we're going to move forward with a neuro exam. So I first like to do the finger-to-finger test. So how this one works is I will have you touch your nose with your finger, and then after you touch your nose with your finger, you'll meet your finger with my finger. My finger will move throughout the exam, but I want to be able to assess smooth, accurate movement, so that's what I'm looking for.
Okay.
So go ahead and touch your finger to your nose, and then to my finger, back to your nose, back to your nose in between, perfect. From here I can identify that he has smooth, coordinated movements, we'll stop there. The next exam is the heel to shin test. So for this exam, you're going to take your right heel to your left shin and then run it down your shin to your foot. It's probably hard in this chair.
Yeah.
Other side. Same thing. I'm looking for normal, straight, smooth movement, which I can tell from this exam that he is coordinated and comfortable. I will now test the reflexes. So starting with the brachioradial. And then the biceps. Okay, and then triceps. I'll have you kind of put your arm out this way. Yeah, forward. Thank you. You'll have to rest here. Relax. Come towards me a little bit. Okay. Relax your arm. Very good. Alright, same thing, relax your arm for me. And then we'll do the patellar, laying down here. This is a little bit hard in this chair because there's not much wiggle room. Okay, other side. Okay. Yeah. And then the Achilles, so I'm going to just come down here by your feet.
Okay.
Very good. His reflexes are reactive and equal on both sides. I'll next test for the Babinski reflex. Very good. Okay, which is present bilaterally. I will next test to see his sensation, so I'll run something soft over his body, and I want you to close your eyes and tell me where you feel soft pressure.
Okay. On my shin.
Which side?
My right shin.
Okay.
My left arm.
Okay.
My right bicep. Right arm.
Okay.
My right foot.
Very good. Okay, I will now have test rapid alternating movements. So I'll have you put your hands kind of on your thighs like this, and then I want you, as fast as you can, but coordinated, to flip them back and forth.
Okay.
Okay, begin. Very good. I can tell that these are smooth, fast movements. I'll have you do the same thing with your feet. Tapping the floor, bring yourself to the edge of the chair so you're comfortable, and tap your toes to the floor as quickly as you can at the same time, both sides. Very good. I'm looking for smooth, fast, coordinated movement while testing the rapid alternating movement, and I can tell that on both sides they're even and he appears comfortable. Was there any pain with that?
No.
Any difficulty coordinating that?
No.
Okay. I will next test the romper test. You will have to stand up for this.
Okay.
And I'm just assessing to make sure that you can maintain your balance here. So go ahead and put your feet together. And then I will have you lift one leg up. Yes. I'm looking for any abnormal swaying.
No.
Go back down, and then other side.
My bad.
Very good. Okay, now you sit back down. Let's see. Now for the next test, you know what? I'm sorry, go ahead and stand back up. I want to test your gait. So with gait coordination, I'll have you walk this direction so I think the camera will still be able to see you. And I want you to place one foot in front of the other.
Okay.
You can kindly get out of your way here.
Sure.
I'll stand behind you to have a good assessment. So this is the tandem walking with heel to toe, and we're just testing mobility. I will now have you return in front of your exam table, and I'll have you stay seated. I want you to hop on one foot. Very good. And then on the other side, to evaluate gross motor movement. Very good.
Okay.
You're okay to sit back down. The last thing that we'll be testing is sensory integration. So I want to evaluate this by, first I will have you close your eyes, and I'm going to hand you an object that you should be familiar with.
Okay.
When you notice the object that I'm handing you, I want you to just tell me what it is, and then I'll have you open your eyes.
Okay.
So go ahead and close them. And I'm handing you something here.
TV remote.
Very good. You can open your eyes. And then I'll have you close them again for another object. The other hand.
Pencil.
Very good. And then the last thing that I'll have you do is I'm going to use this pencil and I'm going to draw something on the palm of your hand. Your eyes will be closed and I want you to tell me what number I drew.
Okay.
This is evaluating graphesthesia. Close your hands. Give me the number.
3.
Very good. And I'll do the other side. It'll be a different number.
4.
Very good. I can attest that I've evaluated sensory integration and that he performed this within normal limits, that he is coordinated, and that he has appropriate sensory. Next, we'll begin with a musculoskeletal examination. This will be able to assess your range of motion and to identify if there's any limitations.
Okay.
If there's anything that you do not feel that you are comfortable or safe to do, we will stop. But we will be able to identify if there's anywhere areas of strain or anywhere that our strength is unequal. While I have you seated, we will first assess to make sure that your ACLs are intact. We do this by using a Lockman's test is the name of it. I'll first ask you to lay back a little bit further here if we could on our exam table. And then I will have you relax your leg. You'll feel my left hand on your thigh for stabilization. And then I'm going to kind of lift up here. I would like about a 30-degree angle at least. And the ACL is intact on this side. Any pain there?
No.
The other side here. Same thing, about 30 degrees. Okay, and the ACL is intact on this side as well. Any pain?
No.
Okay, now we can push this back in. Next thing I'll have you do while you're seated is you could bring your arms out straight with your palms up, straight and even. And then if you could roll your wrist in circles like this. Okay, very good. And then I'll have you flex like you're doing a bicep curl and extend back out. Any pain there?
No.
Okay, I'll next have you move forward. You might have to stand for this, I'm not sure. I'd like you to move your arms in a circular motion up and over your shoulders. Very good. And then backwards. Any pain there?
No.
Are you able to bring your arms out and form a T? Any pain there?
No.
Back down for adduction. Okay. Go ahead and sit down. You're going to want to come to the edge of the chair, and this might be very hard in a recliner, but what I would like you to do is when we're at the gym and we do these to strengthen our legs, I'll have you do adduction and abduction. So abduction is pulling away from your body and then adding back in. I kind of need you to even come forward a little more. Okay. Is that comfortable?
Yeah.
All right, go ahead. Yeah, as far as you can. The shoulders might be kind of limiting. Very good. Very good. You can go ahead and sit back. I will next have you do your arms in candlesticks. Maybe come towards the end of the chair. And then you're going to go out like this and back in. Out like that and back in. Very good. I will then lay you back again. And I'm going to have you do a straight line test. So this is going to look like one leg coming up at a time. I don't want that to fling out of control. Go ahead and lift your right leg in the air for me as high as you can. All right, back down, and left side as well. Very good. And then I will push this back in. Got it?
Mm-hmm.
All right. I kind of just saw this motion from you putting the recliner back in, but if you're able to come back out and bring your toes together up and back down, and then one leg at a time. Any pain there?
No.
Are you able to roll your ankles?
Yes.
Okay, and the other side. Very good. I'll now do push pulls. So I'm just looking for if you're comfortable with resistance.
Mm-hmm.
You'll come to the edge here, edge of the chair. And on this leg, go ahead and lift up towards me. All right, very good. And then I'm going to come underneath here, push down. Very good. I'm assessing to make sure that his strength is equal. Up towards me, down, and then down towards the floor. Very good. For your shins here, out towards me. Very good. And then keep them out. Now back towards you. Very good. And we'll do this with your arms as well.
Okay.
So your wrists here. Go ahead and bend at the arms. Now out towards me. Very good. And then in towards you. Very good. And then with your feet. So I'll have you push down on my hands like a gas pedal. And then towards my nose. Very good. Same thing on this side. Down like gas. Up towards you. Any pain or limitations there?
No.
Any weaknesses?
Nope.
All right. That would conclude our head to toe examination with as much as we could get done in the space of our living room. I thank you for participating in this educational opportunity and for your consent to be on video.
Mm-hmm.
On behalf of Cleveland State, we love this opportunity, and we appreciate your time and being willing to be recorded. Thank you.